Welcome to Season 1 of the Home Healthcare Today show. I am your host, Dr. Cleamon. Good afternoon and welcome to the very first installment of our podcast titled Home Healthcare Today.
Let's take a sec to think back. Bringing back in the day. Take a sec to think back like this. Go inside your mind and find a time that you miss. Let's take a sec to think back. Bringing back in the day. Take a sec to think back like this. Go inside your mind and find a time that you miss. Let's take a sec to think back.
Would you recommend in-home physical therapy and occupational therapy and perhaps even skilled nursing for clients who are recovering from COVID-19?
Definitely. I feel that anything that a person can do to move towards their baseline is important. No matter what a person is dealing with health-wise, if it's something that they have not experienced before and they don't want it to become a permanent part of their life, they have a right to fight against that.
Absolutely.
And there are trained professionals that have tried and true and measured interventions that have helped people from very difficult situations.
Absolutely.
And especially if you're dealing with things like feeling fatigued and you just don't have the stamina, or some people have like neuropathy, which is a nerve pain that results from it, working with situations like that. Just feeling that you're not able to take care of your health care needs because you don't have the energy, or you might be having some residual problems with shortness of breath,
yes,
with chest pain, things of that nature. And that can be a scary place to be in, having a trained professional at your side to not only help you to stay adherent to your treatment plan, not only adherent to the recommendations, but be a liaison for you between your medical provider and what you're experiencing in the home, give you that extra added support.
So when I operate on someone's heart and we put a stent in, it's not over. The patient has to take medications, they have to engage in cardiac rehab. If patients have cardiac surgery, heart surgery,
yes,
they may be in the hospital for 3 to 4 days, but when they go home, they have to be able to ambulate, they have to be able to work with an eccentric spirometer, to take deep breaths, have breathing exercises. So it doesn't stop. The treatment doesn't stop when you leave the hospital. And that's why it's so important, at least in the home healthcare sector, that you have dedicated healthcare professionals who are going to come into your home, who are trusted, who are going to help you recover and heal.
We know that the support that helps keep people in their homes, helps keep people out of the hospital, is tremendously important. These home health services even can help people stay healthy within their home, manage their condition, give them the assistance they need, give their family the assistance they need, who are often working, and pull them in a lot of directions and bring in some extra assistance can be tremendously helpful.
So, Doctor, how would you suggest encouraging minority patients and populations to consider home health care as an option as part of that multimodal approach to healthcare and wellness?
Certainly, and I think once education is factored into this, and cultural competence, and an understanding of, hey, you're from, this is a patient that's from, East Detroit, where our clinic is. Hey, we understand this patient, and they're going to feel more comfortable, speaking to us as a result. I think the other thing is providing excellent services. So one of the things that we pride ourselves on is trying to deliver state-of-the-art care, and regardless of the expense, to our patients. Just as an example, so as a sports medicine physician, I specialize in ultrasound guided procedures. We purchase ultrasound units, and we deliver point of care ultrasound right when patients come into our clinics. And so I think providing an excellent product, a product that is culturally competent,
Yes.
I think the rest naturally will follow.
That's it.
And so I love the way that you really kind of broke it down to, why should we trust you?
Yes.
I think ultimately it comes to a question of why should we trust you?
Absolutely.
And I think it's about building that trust. And it starts with cultural competence.
What is your recommendation for some of those homebound women in the Detroit area that say, but I want to take care of my house, but I need help with myself, I need help getting dressed, I need help with even exercise or keeping my medications aligned and in order. Would you recommend home health care for the homebound?
Absolutely. And not just for the homebound. Again, women are the primary caregivers. And if we're working outside of the home or we have too much going on, we're not going to take care of it by ourselves. I took care of my mother working full time for 20 years as she went through Alzheimer's. It was very difficult. And I didn't want somebody in my house because I'm like, oh, somebody's gonna break in and take this and take that, or they're not gonna take care of my mother as well as I would. Oh, people are gonna look down on me because I didn't take care of my mother myself. Well, we have to be realistic,
True.
okay?
Absolutely.
God gave me the ability to work
Yes,
and do
ma'am.
what I'm doing so I would have the finances to be able to do this. For people who may not have the finances, there are ways of getting home health in there.
Yes.
Do not be embarrassed. Do not say, oh, no, I can do this all. None of us can do it all ourselves. We need to be a village. We need to help each other do better.
100%. And I want to elaborate on this because I think this is so important, is especially here in the city of Detroit, not just the city of Detroit, but elsewhere, communities can really benefit from what I call the home-based model.
Mm-hmm.
And I'm very, very proud to say that when I first started with the health department, one of the first program I actually worked with Dr. Moore was the Childhood Lead Poisoning and Prevention Program. Yes. Wonderful program at the health department. Absolutely. And I got to give another shout out to the folks that are still doing that hard work. They're a small team, but they are some of the hardest working group of women that I know. And I just want to say that. And so in this experience, I got to go to patients' homes. Yes. and see the home environment, see the community environment, and I saw firsthand, Dr. Moore,
Yes.
the benefit of meeting the patients and families where they're at, not where we're at,
but where they're at. Yes.
Yes, sir. And so when we did that, the amount of support and feedback that we got back from our patients,
Yes.
the kids that we serve and their families, was nothing but positive.
Home care is critically important because people want to stay home.
True.
They want to stay in something they're comfortable in. Mm-hmm. It's very hard if somebody has to go to assisted living or something, then you've got to move some furniture in like that.
True.
But if somebody can stay home as long as possible, it reduces the problems that will come when more and more people need assisted living. Yes. But if you can make the house usable, so one of the first things you do is get somebody to come in and say, who's going to trip where?
Right. The fall and safety assessment.
My parents had rugs everywhere.
Yep.
They had things all over the floor.
Yes.
And just having somebody to come in first in terms of OTPT and make the house a little bit safer.
Absolutely.
If you're using a walker, having bumps in your road is going to be really difficult.
Absolutely.
So how can we reduce hip fracture? How can we reduce leg fracture? One of the ways to do it is to check your home.
once again, this is season 1 of the Home Healthcare Today show. Should men consider home health care and even not just the skilled, but maybe even private duty home care to assist, in managing debilitating illnesses?
I think both men and women, everyone who in need or everyone who's homebound, they need some kind of help.
Yes, sir.
What's good about the home care is that you take the care to the patient in their own home, their own environment. That would help patients with mobility, with physical therapy, with occupational therapy.
Yes.
Not only that, communication is easier now.
Yes.
So in the past, you have to wait for a visiting physician to come and see the patient every now and then. Now every patient can be helped by their visiting nurse,
Absolutely.
by their family member. They can schedule virtual visit, video conferences with their physician and providers,
Yes, sir.
and that can help to provide the care in their home environment.
And I think it's important to point out, yes, well, some people may die from sarcoma.
Yes.
There are people that also are cured of sarcoma, and I want to make sure that we get that message out as well. But we know that we're not always successful.
Yes.
But in the path of treatment, we engage home health care, and home health care is so important. I know that within the practice at the University of Michigan, we try very hard for people to get as much of their treatment at home.
Yes.
Stay out of the hospital.
Yes.
Won't want you there.
Right.
There's nothing like being in your own bed.
True.
Nothing like having your own food.
Yes,
and
ma'am.
so home health care is that bridge that helps people to be at home, to receive a lot of their care at home in the supportive care. And so they only come to the hospital for the things only that can be done at the hospital, versus home health care partnering is just critical for people being able to just live their lives.
As you know, American Advantage Home Care, we take care of hundreds of homebound patients across Metro Detroit. Eddie, and what would be your recommendation for, homebound patients to, should they seek the product, or should they ask their gerontologist or primary care physician about it? What would your thoughts be for some of our homebound folks that want to increase the sharpness of their mind, or their brain, and cognitive ability?
Yeah, that's a very good question, because as we know, people, once they become isolated, if they're homebound and not getting a lot of interaction, the brain does start to get foggy, and unfortunately, in some cases, leads to quite a bit of depression.
Absolutely.
I would suggest that they take the product. Listen, at the end of the day, everybody in this room, everybody should be taking the product. So that, to me, we talk about, I'm going to take an aspirin for my heart, I'm going to take a multivitamin. Yep. Well, we don't really do anything for our brains, and we need our brains to work.
Unfortunately, without a detection test, most people think that a Pap test or a Pap smear will detect ovarian cancer. It does not. There is no diagnostic test. So when you are having your annual physical checkup, you're not being screened for ovarian cancer. There may be a pelvic rectal exam done, but if a tumor or anything is found at that time, it's going to be in that advanced stage. So only 15% of women are found early stages when it's most curable. The 5-year survival rate in a stage 1 is 90%, and the 5-year survival rate in a stage 4 is 17%. So that tells you how dramatic the drop-off is. And so, unfortunately, going through this, and as I can speak personally for my mom again, that downward decline. I think as a caregiver who is a health professional and thought she knew how to take care of herself, but there's a lot of stress that goes with it, and I think taking time for yourself first and foremost, and I think that's where a home care agency like American Advance can come in and help, because giving that respite care, giving that time for the caregiver to go out and do something they love. I was recently reading about the caregiver stresses, and so much of that is real, and I look back on myself and go, oh my goodness, the anger, the irritability, and it's healthy. It's a healthy break to be able to take that and do something for yourself. So if you have the opportunity to have a home care agency, someone you trust to come in and care for your loved one, that would be huge. And not to mention the medical side. Being a nurse, there's the medication, and there's the, as you get into the advanced stages and the terminal stage, having the morphines and the medication, that gets confusing, and you don't want your loved one to be overdosing. There's a fine line between what's a comfort level and what's an overdose level, and so having skilled nurses who can come in and help would really be an advantage too, and recognize I think just overall comfort for everybody.
It's very absolutely important to have home health physical therapy, for that matter, home health services, including the nursing and other services. It's so important because when we get to people's home, we help them to get up and move, and having a knowledge being a medical professionals, we understand what it takes to take care of the sutures, for a knee replacement or hip replacement, or a back weight bearing status, or non-weight bearing or partial weight bearing status, or different precautions, how to hold the sutures to cough. And stuff like that, and if you have a swelling, how to elevate your legs, and all those kind of things, and movement. And we being there for 45 minutes to 1 hour, help them, to encouraging them to do all those things, and assessing their home and seeing what they have in their homes, use that as a means to help them to use that, rather than a lot of people think that they need dumbbells. They need a can of beans is more than enough, or a gallon of milk is those kind of things are enough. Or if they have 2-3 steps, go up and down the steps.
Absolutely.
And especially climbing stairs is a big problem, because most of the seniors have an issue with the balance. A little bit of balance exercises. It'll go a long way.
I think it's a wonderful thing, particularly when you take into consideration that if a patient has a vision problem, it may be more difficult for them to self-administer their medications. For a diabetic to give themselves insulin, for example, can be very challenging. So the ability to have assistance in that respect is oftentimes the difference between staying at home and being in a nursing facility.
In short, this is where teamwork in medicine becomes really paramount. The coordination of care between not only the doctor and the patient, but also perhaps a home health aide, perhaps sending the patient to a virtual meet and greet with other diabetic patients where they meet maybe weekly and talk about the challenges around using insulin, etc. So there's a lot that goes into it. Working with a pharmacist to make sure that the medications are delivered at the patient's homebound. We mail some medications to our patients. We deliver some medications to our patients as well. And so, if that's a gap that needs to be closed, we can assist with that. But, oftentimes it's going to be the pharmacy that's sending out the medication. So there's a lot of coordination to go around to make this manageable for people.
It is.
If somebody is going to be taking care of your loved one, you want to know who they are.
You got it.
And having the data available, having the information available so that you can make that assessment. And it's not unusual that somebody making that assessment might be in New York.
Yes, so true.
Mom and dad are here in Detroit.
Right.
Mom or dad. Or both. And so it's really important, I think, as an industry association, that we help agencies rise to the top. Organizations like yours who are doing extra things in order to develop trust and to develop the policies and procedures that can essentially give assurance to the patients and their families that the care you're giving them is the best.
Indeed.
And that you're able to do that in a way that they have confidence.
Yes, sir.
That the people providing that care know what they're doing and have compassion and skills necessary in order to be effective and to do the best job possible.